Now to our mental health moment of the week. Whether it's Christmas, Hanukkah, New Year's, mental health challenges do not take a holiday. And here to discuss what programs are available for those who might be struggling on certain holidays is Sweetser's Joanne Grant. Thank you so much for being here. So, many people worry that things will be closed on these holidays, these actual days, but that's not necessarily the case, is it? I mean, help is still out there.
Absolutely. That's a very common concern, but the most important thing for people to know is that help never takes the day off. Crisis support is available 24 hours a day, 7 days a week, 365 days a year, every single holiday. The goal of that is to reduce barriers so that hope and healing are accessible no matter what the calendar says. I know you're aware that Sweetser operates mobile crisis across the state. We also have several crisis residential units. A crisis residential unit is a short-term stay, typically 3 to 7 days, where someone who is in a mental health crisis and referred by the 988 crisis line can come and stabilize the crisis and get connected to longer-term treatment and support services in the community. We're very excited to say, and I'm proud to say, that our crisis team during this time of year go above and beyond to make sure that anyone coming through that door feels like home. It feels like home. They have a bunch of Christmas activities planned, whether that's crafts, decorating cookies, giving one another gifts. We also have some specialty groups that we're offering, such as grief, loss, and loneliness during the holiday season, how to manage stress during the holidays, and most importantly, how to practice self-compassion during this time.
You've kind of already hit on this, but what could somebody expect if they reached out for help? Who might answer the phone? Who might show up? Who might they be talking to?
Sure. So most of the calls come through the 988 crisis line and then go through our crisis workers, and they make a referral for this level of care if it's required. Once that individual goes to the particular program, the first thing that will happen is an individual assessment that addresses their current needs. After that, we're really going to tailor therapeutic interventions, monitor them based on those needs. Two other important pieces of a visit at a crisis stabilization unit regarding safety. One is creating a plan of safety activities once that client leaves. They have a plan for things in the community that might be helpful to keep them feeling stable, whether that's attending support groups, getting therapy, or medication management. And then most importantly, the staff on site are ensuring their personal safety throughout their stay, developing a comprehensive safety plan that they get to take with them out into the community and share with their natural supports, because it's really important for everyone to know what's going to help keep this person safe and successful.
And so when they leave, right, it's not just about when they're there.
Correct.
It follows them.
Correct.
The treatment.
Yes.
Yeah.
Yes.
Okay, that's really important.
Yeah.
And what is the best way to reach out? What's the best resource to use if you are in immediate crisis?
Yes, so I know everybody that has come on here from Sweetser talks about the 988 Suicide and Crisis Lifeline. That is the primary resource for anyone experiencing a mental health crisis or overwhelming emotional stress. Everybody teaches us to use 911 for a physical emergency. 988 is for a mental health emergency. You can call, text, or online chat the 988 number, 988lifeline.org. It is free, confidential, and provides judgment-free care by trained counselors. You want to call 988 if you are, or a loved one, are experiencing suicide thoughts or thoughts of self-harm. If you are having increased anxiety, panic attacks, or substance use emergency, or you need help de-escalating a situation before it becomes life-threatening. And 988 is also the way you would access all of Sweetser's 24/7 services, which does include mobile crisis response and the crisis residential units that we were just discussing. We have 4 adult units, Rockport, Saco, Lewiston, in Brunswick, and then 2 child units, 1 in Saco and 1 in Rockport.
So all very important information. Thank you so much for joining us, but especially during the holidays,
Yes.
a lot of people need that extra help. So,
Absolutely.
Yeah, we appreciate your time.
Thank you for having me.
Thank you so much.